So once more, good evening to everyone. I'm called Vanengong, the Vice Coordinator of Diabetes and Hypertension Unit under Home Clinic Foundation. So tonight, we have a very important session, which is on the family planning. So tonight, we have a very, very, very important guest who will be teaching us what to know about family planning. So she's a lot, and she has a lot to show us. So I'll be introducing her to move on. But firstly, I want to thank each and everyone who has made it possible to join in and learn from this important session of tonight. So firstly, I want to also acknowledge the presence of Dr. Brain Taro Quinji, to give us a brief introduction about Clinic Foundation, the mission, before we start. So, Doc, good evening and welcome. So, you have the floor now.
Hello. All right. Thank you so much, Vanil. And thank you for this amazing opportunity. Without waste of time, Home Clinic Foundation simply has a vision of bridging health inequalities in Cameroon via advocacy, which includes education, diabetic and hypertensive programs to promote these patients to live better. Beyond that, so we equally have the desire to help as far as mobile clinics are concerned and leveraging on digital health system. And above all, we want to use research to spearhead these programs. So in a nutshell, Home Clinic Foundation is there to bridge health inequalities through information, sharing through intervention via mobile clinic and digital health systems, and eventually influencing policies in the country via research so that we can achieve health for all, which is what we call universal health coverage. Thank you so much.
Okay, thank you, Doc, for that brief intro. I hope we all know what Home Clinic Foundation is all about now, for those who are not aware. So tonight we have a very, very important guest with us, as I said earlier. So to our guest speaker of tonight is Dr. Tii Ngwachi M. She's a medical director. She's a medical doctor at the Boya Regional Hospital. She's a medical communication expert, and not just that, she's a community health advocate. She's also the founder and program lead of Community Health, which is an initiative that individuals, especially those living with non-communicable diseases, which we know is a big threat in our communities today. So, with her strong background in medical, has a unique ability to simplify complex health information and present it in a way that is practical and relatable, enabling people to make informed decisions about their well-being. So through her work, she has become a trusted voice in the fight against non-communicable diseases, and by also driving conversations on preventive health and community empowerment. So we see that tonight we have a very important guest, and her work speaks for her. So it's an opportunity for us to be here with her and learn, share, and impact each other. So our session this evening is on the family planning, and she's going to be taking us through that. So please, as she's coming in, I want us to keep on sharing the link, and also we can drop questions at the message box. So there's a site there for chat. So as she's teaching or executing us, we can drop our messages there or our questions there. So at the end, we can all go through the questions and answer. So, Doc, you're highly welcome.
Thank you very much, Vanel. Good evening to everyone, and thank you, Home Clinic Foundation, for the great vision that you people are carrying to better the health of our country, our society, and our communities. It is actually a fight that we all have to do, because looking at our health situation is really sad, to say the least. Thank you, Vanel, for the introduction, and to Dr. Londe for the invitation. And welcome to everyone. Thank you for the kind reaction. Please, everyone that has joined us, can you just react to make sure that, so that I'll be aware that you are getting me all right? Thank you very, very much. Okay, without any further waste of time, today we are going to be discussing a very important aspect that affects each and every one of us, because we did not come from space, we came from a family, and we all are planning to have family, or if we have not yet had one, we are all also planning to have our own family. But then before getting to having your own family, there is what we call family planning, and that's the reason why we are gathered here today to discuss that important aspect. So what is actually a family? A family is, in a nutshell, is the most basic social unit in the society. So it is made up of a group of two or more people that are related by either marriage, by birth, by adoption, that are living together, or they have some sort of bond between them. So we all came from a family, and we are all building our own family as well. So planning this family is very important. And I would just like to share with you a very brief story that makes family planning something very, an aspect of medicine that is very close to my heart, because of an incident that happened, and I really saw the importance of family planning. Even with those who feel like they know family planning, they still have to learn more about it. So about 2 years ago, I was a house officer in one, an intern doctor, for those who are non-medical, an intern doctor in a health facility in a remote village, where I was basically living in the hospital. And at night, 1 a.m., it was 1 a.m. when I got a knock on the door from the nurse on duty, and he was like, there is a pregnant woman that has been referred from a nearby village to our health facility, of course, because there was a doctor there. So they referred the woman. They arrived there at 1 a.m. And when he told me like that, he told me the woman is already in the theater. So you can just imagine the scenario. At 1 o'clock, they tell you, and the nurse on this has already wheeled the woman to the theater already, and you are wondering, man, what can be the case? So when I arrived, I saw a pregnant woman. She was at term, pregnant already, and with no sign of life in her, like she was dead. And when we checked, please, can you hear me? Because I'm getting some sort of echo. If you can hear me, well, can you? Okay, thank you very much. So when I examined her, there was no sign of life in her. So it means she was already dead. And the baby also in her that she was carrying, no sign of life as well. So you can imagine. So upon further questioning the husband, because it's the husband that drove her that night on a bike that has no light, on a ghost town day, again, you can imagine the husband carried her on the bike when they were referred. Before they spent about 4 hours on the way, because there was no light, there was no headlamp on that their bike that they were struggling to have, and everything. So upon questioning the husband, she was gravid at 10, which means that was her 10th pregnancy. That was the 10th pregnancy that has actually taken her life away. She has 9 other children. And when you look at their socioeconomic or their income or their level, lifestyle or standard of living, these were people that were barely having what to eat on a daily basis. But that was her carrying the 10th pregnancy. So the husband actually said they were not planning to have any child any further, because even the one they had, they were not even able to feed them. So this one just came like that. They were not planning to have, but this one just came. And that brings us to our topic of today, family planning. If this couple, they knew about family planning or they were practicing family planning, I'm sure this woman would have still been alive. That pregnancy that actually took her life and that of the baby that she did not even have finally deliver wouldn't have been existing. So if they had practiced family planning, today she would have still been alive. She would have still had her 9 children and they would have still been living well and healthy. But it's not the case today. Now the woman has left behind 9 children, very little children, to suffer in a family that don't even have any standard of living at all. They are barely surviving. So imagine a child growing up in such a family already. So the child is already, life is already scoring that child by at least 3-0. So you can see where we are driving to. So that takes us to our topic of today, family planning and why it is important. So over 303,000 women per year die during pregnancy or childbirth, just like our case. And complications of pregnancy or childbirth are the leading causes of death in young women. So complications of pregnancy or childbirth, pregnancy, complications like abortion or complications due to abortion or anything related to pregnancy or childbirth, they are the leading cause of death in young women. And it is estimated that about 30% of maternal death or death of women related to pregnancy or childbirth can be reversed or prevented by provision of modern contraceptive methods. So about 30% or 3 in 10 women who die, the death related to pregnancy can actually be prevented if family planning or contraception is well applied, if the knowledge is well known and it is well applied in women. And also, if women space the births of their children by 24 months, that's about 2 years, nearly 1 million under 5 deaths could be averted annually. So if a woman or a couple can space their pregnancy by at least 2 years, nearly 1 million of children under 5 years of age, their death can be prevented annually. So we see how family planning is very important. So what exactly is family planning in this case? Family planning is your power to choose if you want to have children, when to have children, and how many children you wish to have, and how to space your pregnancy when you eventually start having those children. So family planning is not just about not wanting to get pregnant or preventing pregnancy. It starts from when you are even planning that I will have children. I'm sure we must have sat down and said, maybe I would like to have 4 children in the future and this and that. That is part of family planning already. And when do you want to start having those children? How many of them do you want to have, and how do you space them out? So it allows family planning allows couple to anticipate and attain their desired number of children and the spacing and the timing of their birth. So next slide, please. There are 4 major components of family planning, where we have contraception, that is prevention of pregnancy by natural or artificial means, because many people always feel like family planning is equal to this aspect, contraception. Contraception is just a term under family planning. So family planning has contraception, that's prevention of pregnancy, fertility awareness, counseling, and permanent methods. And it is achieved through the use of contraceptive methods and treatment of involuntary fertility, because family planning also involves a couple who they are looking for children. Remember, our definition had if you want to have children, and if you want to have the children, how do you get them? If you have challenges of infertility, you have to treat them. It also falls under family planning. So that takes us to why family planning is important. Why are we talking about this? What are the benefits of planning your family ahead of time? It benefits both the mother, the father, the children, the family, and the entire society as a whole. Because to the mother, it reduces her health risks and reduces the number of maternal deaths, just like our woman that we started with. If she had planned her family well, she wouldn't have died. And fewer pregnancy-related complications, because honestly, pregnancy alters a lot in your body. You're at risk of a lot. And the more you get pregnant and give birth, is the more your risk increases. And it also creates time for you to pursue other goals. You will not pass all your life getting pregnant and giving birth. when you plan your family well, it will give you time to also pursue your other goals and also empower you. You feel yourself better like a human, as a woman. And to the children, it ensures a better chance of survival at birth, promotes better child nutrition, promotes physical growth and development, and prevent birth defects. This to the children is because imagine you are in a family of 10, for example, like that woman, and they are barely feeding. People cook one small pot of rice instead for you to feed well or even use the money to cook a rich food. You want to try to manage so that everybody will have a bite of it. And at the end, you are malnourished. At the end, they cannot even take care of you because the money for school fees may not even go around. So you find yourself wanting. So if your parents had planned their family well, you will not find yourself in such a situation. And to the father, it allows the man to keep a constant balance between his physical, mental, and social well-being. As a man, I know the men here, those who already have families, when you are not able to balance, you are stressed between family, work, and other things, you cannot even provide for your family, you feel like you are less of a man. So family planning will help you to balance yourself in all aspects of life, because your life will not be weighing on one side because you are found wanting on one side. And it increases your sense of respect in the society and also in your family, because you are able to provide the type of education and home environment that you truly want for your family. Then it makes the entire family happy and they enjoy a better life because you are able to manage every resources and take care of your family as well. And also to the society, it promotes healthy family, healthy society, and alleviates poverty. That is the Sustainable Development Goals. So we move on to the next slide, types of family planning or contraceptions here. So when we are talking of family planning and you want to, for example, carry out your own method, plan your own family, what are the ways, what are the means through it? So we are talking about the types of family planning, where we have natural means, the barrier means, hormonal methods, permanent methods, and intrauterine devices. As you can see on your screen, this image, the one with contraception methods, I would just like you to have it in mind, because you are going to be discussing a lot and making reference to this table, because it entails so many of the methods we are going to talk about. Because when people hear family planning, they'll feel like from my experience, interacting with patients and so on, when they hear family planning, they just feel like it's just one type, that hormone that they inject or they do this and that. So they'll just like, no, I don't want me family planning. But that's not just all about it. It involves even you understanding your menstrual cycle. That is family planning. You using condom in the process of sexual intercourse is family planning. So we are talking all about this. Now, we move to the natural methods of family planning. So we are taking the first one, natural family planning methods. So this, as the name goes, natural, it means that nothing is artificial about it. So it does not need any drugs, any devices or chemicals that is injected into your body. It depends solely on avoiding intercourse on your fertile days within the menstrual cycles. So these are the natural methods, and they include a calendar method. So you have to, before you undertake this natural method, you have to have a good mastery of your menstrual cycle, so that you can avoid days that you are fertile. Because for the people that are not in the medical field, in the nutshell, family planning just want to prevent pregnancy to occur, like pregnancy to grow. So first, before you want to get pregnant, there's what we call ovulation. Ovulation means that your ovary produces an egg. It releases an egg that is supposed to be fertilized. So during the process of that releasing the egg is ovulation. And then this egg now, there's a sperm that has to come and meet this egg and fertilize it. And then this fertilization, once it is fertilized, where it gets fertilized, it has to move to the womb and get implanted there or stay there and then start growing like a baby before pregnancy can actually occur, before we can say that pregnancy has occurred. But now, family planning or contraception, we want to stop any of this process from happening. Either your body releasing the egg during ovulation, or preventing the sperm from even reaching the egg at all, or preventing it from fertilizing the egg, or preventing it from getting into the womb to start growing there. So now, with natural method, is just like trying to make sure that sperm does not meet that your egg that has been released during ovulation. No sperm meets your egg at that time. So you try to avoid sexual intercourse during the time of your ovulation. That's what we call the fertile days, when there's high probability that the sperm can meet the egg. So with the calendar method, you just have to understand your menstrual cycle. And for you to understand your menstrual cycle, it means that the first day that you start menstruating, you, in a nutshell, you jot it down, and then the next time you menstruate again, you count the number of days in between. And you have to do like that for at least a period of 6 months for it to be effective, because you cannot depend on just 1 month or 2. You have to do it like that for at least 6 months to track your cycle, to know that your cycle lasts for how long. Is it 28 days? Is it 30 days? And from there now, we can always talk about the calendar method of calculating your fertile days in another webinar. And then, so that's it about the calendar method. You see that nothing is introduced into your body. It's just your knowledge of knowing when to have intercourse and when not to have, in order to prevent pregnancy. Now, the basal body temperature, it has to do with you monitoring your body temperature every day, because during ovulation, or when the egg is released from your ovaries, there's a surge, there's a spike in your body temperature normally. So if you, for you to be effective in this method, it means that you have to measure your body temperature every day and you plot it. And then the time that you see that there's an increase, abnormal increase in your temperature from the previous one, know that your ovulation has occurred during that period. And then you have to avoid sexual intercourse at that time. But this method is actually for, it cannot really be so reliable, because external factors can affect it. For example, if you get a malaria along the line, your temperature is going to actually rise, but that doesn't mean you're ovulating at that time. So the basal body temperature is actually a natural method, but it's not also so reliable because of external factors. Now, another next natural method is cervical mucus method, where you have to be inserting your finger into your vagina to reach the cervix to check the mucus that is being produced. And normally during your ovulation period, the mucus actually is the consistency is a bit slippery, and it's like egg white. It becomes like egg white, and it's a bit slippery, so it can actually draw a bit when you try to separate it. You see that it's drawing a bit, and it's also, it has a high risk of infection, because you're actually inserting your finger all the time to check how is your mucus and so on. So if you check it at that time, normally it's supposed not to draw the way it draws during ovulation. So if you check it and it draws like that, it means that you are ovulating. So you avoid sexual intercourse at that time. And then we talk about withdrawal, or the withdrawal method, or coitus interruptus, where the man is not ejaculating into the woman. So during sexual intercourse, the man, when he reaches the climax and wants to ejaculate, he removes it. And this method also has a failure rate, because most often, before you even want to remove, you want to withdraw, that the ejaculate has already gone inside, or you just feel like, no, you want to finish and enjoy yourself, your sweetness. You just like, that thing, you can even wait. So it is not so reliable as well. But it's effective for those who can be really self-disciplined, even though it also has a failure rate. And then the last but not the least that we are discussing about on natural method is lactational amenorrhea. So it just simply means that breastfeeding is just breastfeeding, effective breastfeeding in a woman that has just given birth. When you give birth, the first 6 months, if you are breastfeeding well, that is effective breastfeeding, and you're breastfeeding exclusively. So you are not like interrupting the breastfeeding or giving other food to the child. If you are breastfeeding effectively, you are not obviously going to menstruate, because ovulation will not take place. When you are breastfeeding effectively, the hormone that helps in breast milk production actually inhibits or prevents the hormone that will help you to ovulate. So lactational amenorrhea is an effective way of preventing pregnancy in a woman that is just from giving birth for the first 6 months of life, if she is breastfeeding effectively. So that method is just effective for the first 6 months, and that is it. And it is only effective for somebody who is breastfeeding effectively. So it should be noted that these natural methods have a failure rate of about 25%. So it is not so reliable as well. So that is it about natural methods. We move to barrier methods. Barrier methods means that you are using something external, something that will act as a barrier or to prevent the sperm from reaching the egg for fertilization. So it acts as a barrier, preventing the sperm from reaching the egg. And they include condoms, be it both male and a female condom. I'm sure if you know about the female condom, can I see a reaction from you? Not just the male condom. Have you ever heard about the female condom? All right, thank you very much. Yes, it involves the male and female condoms, and the diaphragms is also, if you check our doctor, please, can you go back to the slides where he had contraceptive methods? Let me show the diaphragm there. Yes, this on the image, the one that is on your right, far right below, yes, that's the diaphragm. So you can see it. It has to, there is the woman who uses it, she inserts it into her vagina, right, so that it can go and meet the cervix. And most often this diaphragm as well, they use spermicides. So they spray with spermicides, so things that can kill the sperm or will make the sperm not to survive. So the diaphragm also is just a small cap like that, and you insert it into your vagina to reach the cervix. It covers the cervix and prevents the sperm from passing through to get into your womb and migrate to fertilize the egg. And also has something that is something that kills the sperm as well. And then we also have the spermicides, which kill the sperm before they even reach the egg for fertilization. So you can either, there's a spermicide gel that people use that they can, the woman can rub it on her in her vagina, or they use some sort of something that looks like a speculum. They rub it on it and insert into their vagina, so that when the sperm comes, they meet this chemical and it kills them. They will not be able to travel and meet the egg for fertilization. And then we have the sponge. Also, it is almost like the diaphragm, and it is inserted into the vagina before intercourse. So it also contains spermicide that kills the sperm, in a nutshell. So we see that the barrier method is not just the condom, the male condom. It also involves the female condom, which the use is still, many people are not using it because of the disadvantage, because it requires that the woman has to hold it during intercourse and so on. But the male condom is readily available, and is affordable, and protects not just pregnancy, but also sexually transmitted infections. So that is it about the barrier methods. We move on to the hormonal methods, which is what so many people feel like it is all about. It is all what family planning is all about. It's just one of the methods. So the hormonal methods involves your body or introducing foreign or synthetic hormones into your body. And these hormones are mostly estrogen and progestin. Progestin is just a form of because your body normally, the female main hormone of the female is estrogen and progesterone. But progesterone is the natural one, while progestin is the synthetic one that they manufacture and in the lab and now insert into the body in the form of pills and so on. And then they help to prevent ovulation and pregnancy. So it includes oral pills, injections, implants, patches, and so on. So we are going to the first one, which is oral contraceptive pills. So they are the tablets that when you go for family, when you want to go for any contraceptive method, there are some people that will choose it. It involves tablet that you can be swallowing every day, or certain days of the month, like maybe 21 days and skip 7 days, depending on how effective you can be. So it can either be combined or single. The combined pills contain both of these hormones, estrogen and progestin, and they are available in either 1, 2, or 3 forms. And other benefits include it can regulate your cycle, and it may one complication or adverse effect that many people fear is because of the weight gain. And this weight gain is because of these hormones, because I would really like to emphasize on this, because that's what causes a lot of chaos when it comes to family planning, especially in women. Because when one person goes and take the method, maybe she had some complications, she start announcing it to the whole community, and then they will now say, no, that family planning, no. Meanwhile, it's not always the case. These combined oral contraceptives or the combined pills actually causes you to have more appetite or to gain appetite, and you tend to eat more. And oftentimes, what you eat matters. And when you have increased appetite, you tend to eat things that are not so healthy for your body. And it increases your weight, not because it's the family planning that directly does it, but because of it's just a secondary effect of it. It makes you to eat more, but it also increases your body fat anyways. But it makes you to eat more and eat the things that are not really healthy for your body. So this combined contraception does not only help you for pregnancy, it also helps to regulate your cycle. That is why for ladies who have difficulties or irregular menstruation or abnormal bleedings, when they go to the hospital, it's these pills that they give them, because it helps you to regulate your cycle as well. So that is it for combined pills. And the progestin only pills is safe during breastfeeding, suitable for smokers, diabetics, and women who are breastfeeding. That's because estrogen is not so friendly in this group of people. So they remove the estrogen part and allow only the progestin part of it. And it may cause headache and acne. It is not suitable in these people because of the risk, a lot of cardiovascular risk factors associated with it, and the risk that they can actually form blood clots, which can travel to their heart and lungs and cause a fatal condition that we call embolism. So that is it about the oral contraceptive method, please. And then now we move to the long-acting methods, which is the injections and the implants. I'm sure so many people that have done family planning or that have done contraception, they know about Depo-Provera, which is an injection that is given to you every 3 months. You come for it, and it involves those hormones that we talked about. And then the implants placed under your skin, and it can last 3 to 5 years, like Jadeo, that is always placed on your arm, and so on. And then we have the emergency contraceptives that a lot of people know about it, that you use within 72 hours after unprotected sexual intercourse, like the Postinol 2. But that's not the only option. There's actually an option of copper intrauterine device insertion that will actually delays or prevents ovulation, or also delays or prevents the migration of the sperm to meet the egg. So if you have unprotected sex when you are on your fertile period, and this intrauterine device is inserted, remember it takes about the fertilization does not take place just there the same day. So it takes some time. If you insert it immediately or just within few hours after the unprotected sexual intercourse, it can actually help in preventing pregnancy as well. So the next slide, we now talk about intrauterine devices. So there are small T-shaped plastic devices that are placed into the uterus to prevent pregnancy. As you can see in the image, the first one is how the device looks like a T-shaped coil. And then this second image is showing how it is placed into the uterus. You can see how your womb looks like and how the rod is placed into your uterus. So it helps in preventing pregnancy, and there are actually 3 types of it. The first generation that is non-medicated, so it just acts like a barrier. So it helps, this first one will help to prevent implantation. Implantation, which means, remember I said from the beginning that the egg has to get in, the fertilized egg has to get into the womb and establish there and start growing before we can say that a pregnancy has really occurred. So with this coil inside the womb, it will actually prevent that fertilized egg from implanting, from getting into the womb and establishing itself and growing. And then the second generation, which contains copper. This copper like that is having some sort of, from some studies, that it has some sort of spermicide effect. So it kills the sperm before it can even reach, it doesn't even go to the level of fertilizing the egg. And then the third generation is hormonal, where it alters your hormone. Obviously, you may not ovulate, and so pregnancy will not occur. So that is it about intrauterine devices. And what are the advantages of this intrauterine device? Because normally this is one of the best methods of contraception, the best reversible method of contraception, especially the non-hormonal ones. And the advantage is that it is long-lasting. It stays for up to even 10 years. So you place it today, in 10 years' time, you are still protected, and then you can remove it from them, and it is reversible. So at any time that you wish to get pregnant, it can be pulled out, and it is cost effective. Imagine you just spend about 5,000 or 10,000, 15,000 to get your contraception that lasts for up to 10 years. You see that the cost is very minimal, but it has disadvantage of bleeding. You can have mild bleeding and pain because of the rod inside, especially if the insertion method is not so appropriate or adequate, and it has a high risk of infection because as it is there like that, any small germ that you carry, maybe through any STI or anything, or from poor menstrual hygiene and so on, you can get pelvic inflammatory disease frequently. And then there's also risk of it coming out. Like I once had a case where they placed it, but the girl never knew how it came out. They did ultrasound and nothing was found again. So it came out and she did not even realize it. And then we have contraindications, reasons why we should not, there are certain reasons why some women should not take this method, though it's very effective. If you have your uterus that is having an abnormal shape, so if the shape is not like the one in the image you are seeing, because a lot of people have different abnormalities in their womb when their womb is being formed. So that's a contraindication. If you have past history of infection in your womb, it is some sort of contraindication, because this the fact that the rod is inside is also already a risk for infection, and frequent infection in your womb poses you a risk of having ectopic pregnancy, so pregnancy growing where it's not supposed to grow, and heavy menstrual flow as well for some people. All right, we move to the next method, which is the permanent method. So this is for those who no longer want to have children. Remember, all the methods we have spoken about till now are methods that are reversible. So you can, if you want to not have children in maybe 2 years' time, for 2 years, you can get a method that can protect you for that long. And then after you remove it, you can now start having your children and so on. But this permanent method means that once it is done, it is done. There's no going back again. There's nothing that can be done about it. And this method can be done both for the male and the female. And we have vasectomy, that is male sterilization, where, as you can see in the image, this is the male reproductive system. You see the vast difference, and then you see where it is cut. And then for the woman also, we have tubectomy. Remember, tube is where I was talking about, where fertilization takes place, is at the level of the tube. So if you go and you cut this tube, first of all, when the ovulation occurs from the ovaries, the egg will not be able to migrate and reach where fertilization has to take place. So it will not even be able to migrate, and the sperm will not be able to reach there. So it's a permanent method. The egg will never meet the sperm and so on. So it's the female sterilization, and it's done through surgery, where the fallopian tube is either cut or is removed. And it is very effective and safe for both the male and the female. That is it about the permanent method. So now, you as an individual that you are considering to have an effective method of contraception, what does it take for you to have a method? Can everyone get every method, and can you just go for any, and why? So that is why choosing a method is very important. Any choice of family planning method depends on your health condition, your lifestyle, your family goals, and your personal preferences in some cases. Like I mentioned earlier, there are some people that, for example, a breastfeeding mother who is not doing the lactational amenorrhea effectively, and maybe she wants to go in for a family planning method, they'll give her the one that is progestin only, so that they will not give her the one that contains estrogen, because of the risks that she poses because of the post-pregnancy state she's inside, and the fact that she's breastfeeding and so on. She's at risk of so many health conditions. If you are somebody that you have diabetes, your own also, they will have to consider your method. If you are overweight and so on, there are certain methods that they will not give you, because it will obviously lead you to other health complications and so on. And then what are your family goals? Are you doing the family planning method for just, maybe you want to have it for just the next 1 year, 2 years, 5 years, or for how long? It also comes into consideration when they are choosing a method for you. And also what you like. For example, somebody can be eligible to get any of the methods, but she will be like, okay, she may want to have pills that she'll be swallowing every day. Another person will be like, oh, she may forget. She may forget to swallow pill every day, so she will prefer to get an implant that will be there in her body for as long as she wishes. So personal preferences also is considered in some cases when choosing a family planning method. But however, it is always advisable to consult a trained healthcare provider for safer and better options, because you might be considering a method that because you have seen your friend doing a method, that is because you don't know her health condition. She did it maybe by, especially those who complain that, no, when I did family planning, I did me this or did me that. And then because you heard somebody saying that, no, that thing did me this, you just consider, no, that thing is bad. No, go and consult. Maybe that person, maybe the family planning was done by somebody that was not well trained or knowledgeable about it. And therefore, the choice that was given to the person was not the best for her. Or the way they gave her the planning was bad or was poor, and so on. And you cannot judge from any other person's experience. So it's always good to consult a trained healthcare professional for safer and better options. So we move to common myths and misconceptions on family planning. I would just like you to tell me one or two things that you have heard about family planning that you have believed to be true before, that is not really the case. Like I was just explaining, a lot of people, you just hear, just like last week, I had a young girl that post-abortum, she came for a checkup and so on. She did her AB her somewhere. So she came, when I was advising or counseling her that it's better, preferable to get a contraception method or contraceptive method, she was like, no, she heard that her friends who did it are complaining that it did this and that. I was like, no, it's your friend. Have you done it? Is it the way their body responds to hormonal changes or to different methods? It's not the same. Your own body will respond to it. It is better. It is a better option for you to get the experience than to hear from somebody else whose body or whose system is not the same as you. And it's safer for you to do the contraception than to be doing AB at any interval. So please, I would like us to, anybody who is willing, unmute your mic and tell me one or two myth or misconception or what belief you have about family planning that exists in your community or you have heard people talk about. So I'm listening. Hello, anyone? Can you just volunteer? Is it that you have never heard things about family planning that you know that this is not true? Like
Okay,
family planning may cause... All right, thank you.
Have children before you undergo family planning.
Pardon, I didn't get you, please. Vanel, please. Oh, apparently his network is bad. Please, can somebody else, what are some of the myths or misconceptions or things you have heard about family planning that you fear most? All right. I've heard that a lot of people have said that family planning causes infertility, so it makes you infertile, which is a myth or a misconception because it is not true. If you go and do the permanent method, of course, you will not be able to have children again. But if you do the reversible method, it will not in any way cause you infertility once it is removed. So you can, once it is removed, and because there are some sort of small side effects even after it has been removed, but in less than 1 year, depending on the method, those effects, they normalize, so you are able to conceive normally. And then there are also some people who said, all right, Vanel, let me just check it out. I've heard things like family planning is only for women and men have nothing to do in that. Oh, that's very accurate. It's true. It's very true. This is a very common misconception, especially in our communities, that family planning involves only the woman. It doesn't concern the men. I think when we started discussing, I spoke about the benefits both to the mother, to the father, which is a man, and to the children and the entire family. And we also saw that, excuse me, we also saw that the man is also involved, especially like the barrier method, condom. The man using the condom, that's family planning, of course. And also the man is also involved in family planning, because while your wife is doing the planning or is on the method, you have to provide her with the psychosocial support, the psychological support that she needs for it to be effective. So it is not only the thing for the woman, it is for both the man and the woman. And we also saw that vasectomy, that's the permanent method. It's also involving the man. So family planning is not only for the woman, it is both for the man and the woman. I also heard things like family planning causes cancer from people. And that is also, of course, a myth, which is not founded. So we move on to the next, which is our conclusion. So we have been discussing about family planning and the different contraception methods, which involved the natural methods, where we had the calendar method, the basal body temperature, the cervical mucus methods, and the lactational amenorrhea. We moved on to the barrier methods, where we had condoms, diaphragms, and so on, things that will prevent the sperm from getting to the egg. And we had the hormonal methods, where we had oral contraception, oral pills. We had long-acting implants, injections, and intrauterine devices. And we also had the permanent methods, vasectomy, tubectomy, and so sometimes they can completely remove the woman's womb. That's hysterectomy. So they remove the womb, so there's nowhere the pregnancy can occur. The baby can grow. So that's also a method of family planning. So family planning saves lives. It empowers families and it builds healthier communities. It saves lives, like I was explaining the story. It empowers families. It helps you to do other things. It helps you to live to your full potentials. It helps you also to care for, to have a few family, or to have family that you are able, your income is able to take care of and place them well into the society. And if you have healthy families, happy families, of course, you are going to have healthier communities. And it helps to avoid unwanted or unplanned pregnancies. So you will not be a wanted boy in the society because you have gone and impregnated a girl and you are now on a run because you are not able to take your responsibilities just because you did not plan well. So family planning helps you to avoid this type of scenario, and it brings about planned and wanted pregnancy. It makes you to have your pregnancy when you really want it and be able to take care of it when you are, as you really wish. And it helps you to produce a desired number of children. Like the story I started with, the man, he said that one, he was already even tired. That one just came like that. It means he did not even want to have up to 10 children, but he kept coming. So with proper family planning, he would have had a number of children he desired and would have taken better care, and his wife would have still been alive. And it helps you to regulate the intervals between pregnancy. I've seen women who, when after they just give birth, they just their menses don't return again to normal. They are maybe 6 months after giving birth, they find themselves already pregnant, and then they don't want it. So family planning will help you regulate the interval between your pregnancy. Do you want to get pregnant after 2 years again, or how? Family planning helps you do that, and it helps you to have control the time at which birth occurs. So maybe if you have your future plan, that maybe you have a project next year, and maybe you don't want to get pregnant now, with family planning, you will be able to achieve that while still performing your duty, your marital duty, and that is it. So that comes to the end of our discussion today, and the floor is now open for questions and interactions. You can contribute, you can ask your questions, and so on. So the floor is open. Thank you very much for your attention.
Wow. Thank you so much, Dr. Tii Ngwachi M. I must say I've really learned a lot from this session of tonight. And I believe that anyone who has attended this session of tonight has also learned a lot as well. So thank you very much for highlighting this important aspect, which is family planning, giving us what family planning is all about, the importance, the types, and the disadvantages of each. So I really sincerely thank you for such full and inspiring presentation, because you did not just share information, but you give us a life-changing knowledge through which we can be able to make more and better informed decisions concerning our health. So truly appreciate the time, the effort, and the passion you put into this session. And I know that we're leaving here tonight with more informed and we are also better motivated. And I believe that this knowledge of tonight will share it and be able to make more and better informed decisions for ourselves. So thank you very much for that. So please, if anyone here, if you have any question, you can ask your worries so that Doc can help us and answer them. So is any question, please? Okay. I can see a hand up.
Okay.
You can unmute. Yes, please unmute and talk.
Okay. Good evening, everyone. Good evening, Dr. Tii Ngwachi. Thanks very much for that wonderful presentation, and thanks to Home Clinic Foundation for bringing up this initiative. I am nominated Darius Wilson, a fourth-year medical student at the University of Bamenda. So, and I happen to also be a sexual and reproductive health advocate. So, after the presentation, I actually have 3 questions. I hope I'll be able to ask all my 3 questions. My first question is about the permanent contraceptive method. So I wish to know if this permanent one, which you talk about, vasectomy and tubectomy, does it actually have any effect on the libido of that individual? So that's my first question.
All right, please can you just ask all your questions so that when I take the floor, I will just answer. Thank you.
Okay, Doc, no problem. My second question goes thus. As a healthcare provider which you are, has there been any situation which you had to switch from one contraceptive method to another in a particular patient, and what was it? And my third question is thus. How do you manage or convince someone from a religious background that does not accept family planning or contraceptives? So those are my 3 questions.
All right, thank you very much, Tiwa, for the brilliant and wonderful questions. It's really in depth, and I would like to start from bottom up. So I'm starting with your last question to reach the first one. How to convince someone, especially people from the religious background, to take family planning methods. Like I said, with the mindset of people that are religious, they will feel like, no, you are trying to prevent God's, you are trying to interfere with the way God has made things. I first of all have to say that the notion, a lot of people have this notion that family planning method is just about the hormonal methods. So they feel like, no, they don't want to get such a thing. You can, if you talk to them, like raising awareness, and they still don't want to, why not tell them about the natural method? At least it's natural, and the natural is God. You can tell them about it, let them understand, let them go more for the natural, the barrier methods. If they don't want the other methods, there's no problem, but just make them to understand, just raise more awareness and make them see why they have to obtain at least one method for them, for their benefit. I mean, make them to see their own benefit in it, and not just the fact that because some people only have the notion that no, there is some sort of atomic bomb in quotes that are injecting people with it, so that in the future they will be dependent on it, or they will be. That is the notion some other people have. So if they don't want something external to get into their bodies, you can tell them about the natural methods and let them understand their cycle better. But then it is very difficult to really convince people of religious background. So there will be a lot of psychological and mental work when it concerns that person. So that is it for that. And in my clinic, the next question you ask if in my clinical practice we have had to switch from one method to another. Yes. There are patients when these hormonal methods, for example, hormonal methods are some people that are really not tolerant, or their bodies respond differently to the hormones, because you are obviously introducing hormones into their bodies with the hormonal method, and it suppresses the one that their body is producing, so it causes an abnormal increase. And some people are not level of hormones in their body. So when they present with the side effect, you really see somebody that she's like dying, or she's just this thing, I cannot sleep, she feels heat all the time, and so on. And you really see that, okay, it all started when you gave her this method. There's no need to force it on her or something. Remove it and switch to others. Yes, there have been cases like that where we switch from the hormonal methods to the non-hormonal methods, especially the intrauterine device that is non-hormonal. So there have been cases like that. And we have also had cases of failure, where maybe somebody had an implant. This woman, she had an implant, a Jadel. But later on, we discovered that it was because of the person who placed it did not place it well, which is another factor that causes failure in this method. So we also saw that this woman was on Jadel and she got pregnant. So when she gave birth, we had to switch her method. Immediately we discovered she was pregnant, we removed it. By the time she gave birth, we switched her method to something else. So that is a scenario where we have had to switch from one patient to another. Now, about the permanent methods, effects on the libido. Does it affect the person's libido? Let me take, for example, for the woman. For example, you are doing tubectomy, or tubal ligation, whatever you are doing. It does not really affect the hormonal production. The ovaries are still in place. So your hormones, the hormones that causes you to have libido and so on, they are still preserved. As well as for the man, you are not removing, you are just ligating. It's just like you are blocking a road. But that doesn't mean that the organ on the other end is not producing. It still does its function well. Even though there are some people that, though they do the permanent method where they remove the ovaries, especially for total hysterectomy and so on, and oophorectomy, and also for the men where they will have to remove their their testes and so on. Yes, in that case where everything else is removed, your hormones, you are not producing the right level or the right quantity of hormones that your body should normally produce. So obviously it's going to affect your libido to that extent. But for somebody with ligation, just tubal ligation or just tubectomy, the ovaries are still there and it produces the hormone, as well as for the man. So the libido is affected if the organs that are responsible for producing the normal hormones are affected in that case. So I believe I've answered your question in that light.
Yes, thank you very much, Doc. You have actually answered all of them.
All right, you're welcome. All right. In the absence of no question, Vanel, you have the floor. Thank you.
Okay. Thank you so much again, Doc. Thank you once more. And I must say the session of tonight was really, really inspiring. And we hope to have more sessions like this with you in the future. So thank you so much for this inspiring session of tonight. So I would like Dr. Green to give us a few words before we close for tonight.
Thank you so much, and thank you, Doc Tii Ngwachi. I'm so listening again and hearing you speak while dissecting this knowledge in simple language that is easy to be absorbed, really unfolded a lot of aspects about family planning that I really did not emphasize a lot each time I sit on the consultation table. So this is not just an aspect for healthcare professionals, for persons who are coming to learn, but for care professionals, so that this knowledge is passed appropriately and adequately to inform our patients who are going to use this information to take decisions about themselves. In a nutshell, family planning is going to affect us not only within the family but the society. I've seen how the financial harm can be caused because of lack of family planning. They can be harm to your life. They can be harm also to the gross productivity of a nation just because families are not adequately prepared. So this can become a strain to an existing system that is already strenuous. And so it's a call, not just a call for us in this forum, but a call for us to advocate for the right knowledge distribution and right actions that will follow suit, so that we can have a nation that access to family planning becomes easy for everyone and people take decisions that will not only impact their families but impact the nation at large. So thank you so much for this presentation, Doc, and we are going to take it as ambassadors of family planning and take it to as many patients and as many people as possible. This session is going to be available on YouTube so that people can watch again. You can always drop questions in the section where we are in the community, and Doc can also, we can channel it to her and she can also have something as content to create to address these questions. So once more, thank everyone for the sacrifice, and thank you, moderator, for the amazing job.